Hello, everyone, and welcome to the 7th episode of the Vitalycy Patient Safety Webinar. My name is Dan Medici, Marketing Manager here at Vitalycy, and I am joined today by Maimuna Jatta, who is a certified infection preventionist and healthcare quality professional with more than 10 years of diverse healthcare experience in infection prevention, nursing leadership, surgical services, acute care, skilled nursing facility, and ambulatory care. Currently, Maimuna is the Director of Infection Prevention and Control at Carillion Clinic. Maimuna holds a Master of Science in Nursing with a focus on infection prevention and control. Maimuna has a special interest, experience, and expertise in leading infection prevention programs and delivering high-impact initiatives. Maimuna is the immediate past president of APIC VA chapter and a fellow of APIC. Maimuna, welcome to the webinar.
Thank you, Dan. Thank you so much. I'm very excited to be joining you all today to talk about hand hygiene and HAIs.
Without further ado, I'm going to let you take control and start us off.
Thank you. So, like I mentioned, today's topic is going to be focused on hand hygiene and healthcare-acquired infections. My presentation is going to be focused on these three objectives. We'll begin by looking at the role of hand hygiene in HAI prevention. We'll explore some of the barriers to hand hygiene compliance in the healthcare setting, and then finally discuss some of the strategies that can be used to improve compliance as well as sustain practice. To begin with, I think it's important to start where it all begins, the chain of transmission. Every HAI traces back to a predictable pathway, the chain of transmission. If we can name each link, then we can break it. That's the whole purpose. So looking at the chain of transmission, starting with the infectious agent, this could be any of our microorganisms that are known to cause infections in humans, like bacteria, viruses, and fungi. An example of this could be C. diff. We all know spore-forming organisms that are so resistant and persistent on the environment and difficult to break. And some of the strategies that could break the chain from that infectious agent include cleaning and disinfection, as well as stewardship with antimicrobials. So making sure we are appropriately using antimicrobials. And then we move on to the other big piece of the chain, which is reservoirs. So these are where the agents live and proliferate and multiply. In the healthcare environment, this could be anywhere from the patient's bed rails, items within the patient's reach to medical devices and other high-tech surfaces in the hospital environment. Things like sink drains have been known to be perfect reservoirs for those waterborne pathogens. Medical devices like endoscopes, instruments, the environment of care, including the HVAC system, could be a reservoir, like cooling towers. Most of the surfaces in the healthcare environment that are often touched. Breaking the chain of infection again goes back to the cleaning disinfection, but also other programs within the infection control programs like your water management, device reprocessing protocols, and policies. Then we move on to, so the agent, then it lives on something where it multiplies and survives and multiplies, right? And then at some point it has to leave, and that is what we call the portal of exit. And this could be anywhere from human excretion, so respiratory droplets. Like if a patient has a wound, the wound drainage could be a portal of exit. Stool, bloodborne pathogens could be from blood and products. And to break this chain is focusing on the source control, so making sure that respiratory etiquette, wound dressing if there's a wound, drainage system, things of that nature. And then we move on to the mode of transmission. So this is how the pathogen, specific agent, is transmitted from one person to the other or from one surface to the other. And things like contact droplet, airborne ways, and then other vector. Others could be vector. So this is how one infectious agent moves from one body. This could be animal, could be human, to the other. And the ways that we can break this is the most important is really hand hygiene is very effective strategy for breaking the chain of transmission. And then other things like precautions that go along with the specific agent. So that could be PPE based on exposure risk, cleaning of equipment, isolation precautions, things of that nature. And then we have the portal of entry. So if if we're not successful in breaking the chain of transmission from the agent to the reservoir to the portal of exit to the mode of transmission, then the next opportunity is how this agent that has made it through all these steps will leave one host or one individual and transfer to another individual. So in the healthcare environment, there are so many opportunities for this to happen. Our patients are vulnerable. They have so many things that could be going on and so many devices and equipment that they need for their care. Things like central lines are great opportunities for this to be a portal of entry for microorganisms, mucous membranes. The ventilator is also another good example. Things like Foley catheters and even routine IV lines. Anything that has to break the individual's defense system, which the skin is is the largest defense system, and all of these devices, some of them have to require breaking the skin to be able to place them. That increases the opportunity for microorganisms to enter the body and cause infections. So things to consider would be those aseptic technique with the device insertions, as well as bundle of maintenance bundles, and making sure that we're compliant. Hand hygiene is a very important step in that as well. And then it comes down to the individual. So we don't stop the transmission all the way to the portal of entry. The next step is a susceptible host, and most of the patients in the hospital would be considered susceptible host because there are a number of myriad of reasons why they're in the hospital. And oftentimes the body is undergoing a lot of stress that may deplete the immune system. And some people are naturally immunocompromised, or they may be induced immunocompromised based on whatever treatment or illness they're having to deal with. Patients in vulnerable areas like ICU patients, young patients and elderly patients at increased risk, and some of the things that can be done to prevent transmission also include hand hygiene, among a host of other things. All of these measures are effective, but the simplest and most effective is really hand hygiene. It directly interrupts the transmission at multiple points in this chain. Hand hygiene can be effective between the reservoir and the host, between the exit and the entry. Every time you wash your hands, you break that chain of infection. Why hand hygiene really matters? I think we cannot overemphasize the importance of hand hygiene in preventing healthcare associated infections. Hand hygiene is the single most effective way to prevent infections. Research, and there's been lots of publications around this, shows that about 70% of HAIs are preventable with current evidence-based strategies. This means that there is in every 10 infections, there are 7 opportunities that the infection could have been prevented if everyone adhered to the standard um, practice that are evidence-based to prevent infections. So lots of opportunity for everyone in healthcare there to kind of close that gap. But in the same vein, the WHO actually shared this in one of the updates and in a number of the hand hygiene strategies that depending on the setting, about 40 to 60% of HAIs are transmitted through the hands of healthcare workers due to the inadequate hand hygiene practices. This is it can be shocking depending on who's looking at it, but the fact that this is our reality is really unfortunate, especially given all of the technology that has been introduced to healthcare. Access to hand hygiene can be improved, but there's been a lot of work around that, and we're still struggling to close that gap. There's been lots of studies that show that on any given 12-hour shift, healthcare workers, so these are mostly frontline staff, have about 100 opportunities to wash their hands, and about only half of those opportunities are realized. So that means there's always a 50% chance or missed opportunity to wash their hands and break that chain of infection. Proper hand hygiene not only prevents pathogen transmission, but it also reduces the risk of antimicrobial resistance by lowering the rates of infection that require treatment with antimicrobials. And so the ripple effect cannot be overestimated. Um, every time you clean your hands, you are not just following policy, you are actively preventing infections and protecting patients. So a little bit about hand hygiene, just focusing on those 5 moments of hand hygiene that, the WHO has published this since 2009, and it's still very relevant. The 5 moments are very critical. If you're in healthcare, you understand that these are very difficult to realize all the time. There's always room for improvement. We'll talk about some of the barriers, but as we're listening, maybe think about which of these 5 moments really you think is most often missed in your practice and why that is, and what you can do to hopefully improve compliance with these. So shifting a little bit to talk about the HAI burden on healthcare and patient safety. Patients with HAI have longer hospital stays, higher mortality rates associated with HAIs, and greater hospital costs compared to those without HAIs. The AHRQ did an analysis and published this data that supports this well-known facts about HAIs. There's been lots of research and publications looking at comparison for those patients that do not have infections versus those who do have an infection during their hospital stay. Again, focusing on the HAI burden. So when we look at this is a statistical analysis by the AHRQ that's published by Miller et al. And what it looked at is the median length of stay in hospital mortality rate and total cost for adult inpatient stays with HAI among those top diagnoses. So they looked at diagnosis. And in this chart, you can see the impact of COVID. During the pandemic, patients with HAIs and COVID experienced even higher mortality and cost burdens compared to those patients who did not have an HAI. From 2016 to 2019 overall, HAI rates declined steadily, but post 2020, increases were seen in certain infections, especially the ventilator-associated pneumonias and C. diff. And I think it's predictable why that may be the case. Um, some HAIs like CLABSI and CARDI remain relatively stable, but have not decreased, and they still present significant patient safety threats. HAIs directly affect patient safety and quality of outcomes, and can be a financial burden depending on how long that extended stay in the hospital is. Um, it has directly impact exposure to antibiotic agents, or other antimicrobials, depending on the causative pathogen. And on this slide, this SNP is from the CDC MDRO threats that was published in 2022. And on this, it shows that the pathogens like CRE, MRSA, VRE, ESBL producers, and other multi-drug resistant organisms have seen an increase and remain very high since 2019. Candida auris continues to expand as an urgent threat in healthcare in the US. And these organisms are difficult to treat and linked to worse outcomes in some of the patients, especially when comorbidities are taken into consideration. They also can increase length of stay in the hospital, which predisposes patients to other negative outcomes. Higher cost of healthcare for both patients and the healthcare system, as well as mortality rate, have been associated, increased mortality rate with these MDROs when other comorbidities are factored in. Hand hygiene is a frontline defense, and there's a lot of opportunity to curb the increasing threats of these MDROs by doing the most basic things that we can do as humans, as healthcare providers. The WHO estimates that 40 to 6% of HAIs are transmitted via healthcare workers' hand. That is a significant number of HAIs when you think about it. And we have the means and the capacity to improve hand hygiene compliance and prevent these infections. Every missed opportunity increases the risk of spreading resistant organisms in the healthcare setting as well as between patients. So improving hand hygiene compliance directly reduces transmission of MDROs, making it a simple but very powerful step to improve patient safety when you think about it in the global scheme of things. And so we're going to shift gears a little bit and talk about some of the barriers. These are some of the known barriers and some of the human factors, issues that contribute to low compliance with hand hygiene. Things like time and workload demands can cause missed opportunities because, after all, we're all humans. If people are moving 100 miles an hour trying to get things done, it's only natural that some steps may be skipped. Unfortunately, the most critical, which is hand hygiene, is often skipped and can cause harm in the long run. There's also issues of limited access to hand hygiene stations within the point of care, so close to the patient's beds and in the room, so that healthcare workers have quick access, especially during those critical moments when they're caring for a patient or doing a critical procedure, or time becomes a factor if the patient's life depends on how quickly one can act. Other concerns around non-compliance have to do with skin irritation, and with some of the hand hygiene products that are available. Some people's skins are more sensitive than others, and so that may discourage use, especially if it's required to be used more frequently. Um, other times, other things also include like glove misuse. There's this perception, a false perception, that gloves can replace hand hygiene, and oftentimes people skip hand hygiene and get to the gloves thinking it can protect. This is a false sense of protection. And then the equipment placement. So again, the environment. If the hand hygiene stations are in locations that are not easily accessible or that are practically impossible to access while maneuvering around the patient, it just does not create a conducive environment to promote compliance. Other things like human factors and the habits. So people's habits drive behavior, um, automatically leading to lapses. And so if people have, habitually don't adhere to safety strategies, then it becomes natural to skip hand hygiene. There's also the risk perception. Staff may underestimate transmission or overvalue the gloves as a means of protection against everything. That could be a knowledge deficit that needs to be addressed. And then there's the social norms issue, so the culture of the organization or the unit specifically. If everybody does not do hand hygiene, then it becomes a bad. If there are maybe a culture of safety that promotes feedback, that could be easily addressed. And then, fatigue and burnout, depending again on the patient population, sometimes healthcare workers are just too tired, and that is not an excuse for ensuring patient safety, but it's a reality that needs to be assessed and addressed. And we're going to skip quickly to what can we do to improve compliance? I especially like this the World Health Organization's framework for hand hygiene, which approaches it from a multimodal perspective. And I think this is very much in line with infection prevention. Infection prevention, a good, effective program is multimodal, it's multifocal, it's multidisciplinary, and this is the approach that we need to review hand hygiene from. And so looking at the systems that make it so that people are able to wash their hands, and making hand hygiene easily accessible at the point of care, close to the patient, would maybe increase compliance. The steps that healthcare workers may need to take to get to a stations by itself may be discouraging, especially if they're working in a very fast-paced environment. Making sure that hand hygiene products are readily available. Oftentimes we hear reports about the hand sanitizer stations being empty. That is very discouraging, and it may not promote compliance if people have to work to multiple dispensers just to be able to wash their hands. And then looking at products that are more user friendly, that may be less irritating to especially individuals with sensitive skin. And then training and education. I think we underestimate how much education is needed around hand hygiene, because it's supposed to be a natural defense system that everyone's been taught since we were little kids. But the truth is, there's a lot of misperceptions and misconceptions that need to be corrected, even going from what type of hand hygiene to use when, to the technique and how to effectively wash hands. Those are all things that require education, reinforcing those 5 moments of hand hygiene, in providing opportunities for real-time feedback to make sure that those opportunities are not missed. And then looking at evaluation and feedback systems. Again, hand hygiene is not something that you teach one time and be done. It has to be continually reinforced. And so finding ways to ensure that there's good feedback system to make sure that we're catching bad practice in real time and correcting it before it leads to patient harm. Monitoring compliance and providing that data back to the end users, the units, in a way that makes sense to them so that they can build action plans based on the data. And then things like other strategies, right? Create reminders. So things that, again, in a fast-paced environment with competing priorities, it is natural to assume that people forget. And so making sure that there are prompts and visual reminders that bring hand hygiene to the forefront at all times. Basic things like posters and signage and visual cues that remind people to wash their hands. And then creating an environment that allows for individuals to hold each other accountable from the top down. Leadership support and a strong safety culture will drive lasting improvement. Sustained hygiene compliance requires multimodal approaches, like I mentioned before. It requires the integration of systems, education, feedback, reminders, and culture all working together to make it sustainable. And then we skip a little bit further to how can we sustain these improvements once we've been able to put them in place, and how do we measure impacts so that we can drive continuous improvement. Sustaining impact really focusing on success and celebrating the success. I think that is also one thing that we underestimate. We set big goals, but it's important to celebrate the small wins those along the journey to meeting those big goals. Success depends on leadership and the culture of the hospital, organization, the unit, whatever it is that you're focused on. Hand hygiene must remain visible, and it has to be an organizational priority from the top down. There should never be a question about where hand hygiene fits in the organization's quality framework. Um, it should provide continuous education and training through onboarding. So people being hired new should know what the organization's culture and expectations are around hand hygiene, and refreshers, whether it's annual, biannual skills and competency checkups. Hand hygiene should be integrated into all those aspects. It should be embedded into practices and workflows to make it easy and make it become part of the daily routine. Hand hygiene should never feel like an extra step. It should be a natural integration into workflows. And using that feedback and transparency to make sure that performance is being communicated to the people that need to hear it, as well as celebrating those success. And then connecting really the efforts of hand hygiene really to the broader quality and safety framework for long-term integration. It should be part of the larger focus on safety. And then the other big piece is just measurement. So how do we measure hand hygiene, making sure that we're tracking progress and reporting back, monitoring outcomes with infection data, making sure that our surveillance is standardized so that we can compare apples to apples, using balancing measures to catch unintended consequences of some of the interventions that go along with improvement, and then using our data to help strengthen the program. So it may be how do we monitor the program. It could be direct observation. It could be electronic. Could be patient outcomes. Whatever we're using, it can be multimodal to make sure that we're capturing all the aspects that we need to, and then metrics that will help us with continuous improvement. I know we're very close to time, but this was the end of the slide. And so the next thing we're looking at is some poll questions that I think, I don't know, Dan, how you want to, but I know we're at time.
Yep, we are getting close on time, so feel free to drop your answer in the chat. We'll give you guys about a minute here, maybe a little less, to submit your answers. Feel free to also drop in any questions you might have, and we can try to answer those once we finish these polls. We have one question here. It says, thank you, Maimuna. Any tips to keep leadership engaged using specific types of data with these measurements, HAIs, costs, etc.? Any you found most impactful?
Yes, that's a really good question. So it depends on level of leadership. I try to tailor my message to leadership based on where they are on that hierarchy. So depending on the leader, for some leaders, it may be the cost that matters to them the most. So I try to tailor the message around the cost and what hand hygiene compliance, improved compliance could do from a cost perspective. For other leaders, it may be reputation. And so that's where the HAI counts, HAI performance compared to whoever you're being benchmarked against may be helpful to present. And then for unit leadership, if it's a system that has some type of metrics where what leaders are measured against, and you can tie in how hand hygiene can help them meet those metrics. That's how I kind of approach it, tailoring it to the individual leader or the group of leaders that you're targeting, and then looking at what will be most what will poke their ears, depending on what they're focused on, is how I approach it. And then you have some leaders, if you have like mid-level, where all these, the HAI matter, performance matters, cost matters, patient safety matters, then you can bring a myriad of all of those data points and plug in how hand hygiene compliance can help improve. I hope that answered your question, Haley.
That was great. So we have Patricia saying safety culture is one of the biggest barriers or most common at their facility. And Tammy is saying culture change or facility culture change as well. Okay, cool.
Yeah.
Let's move along to the next one here. We can do this one, and then we'll probably be done on time. So if any last questions you might have, please feel free to drop them in the chat. Patricia said lack of accountability is one of the biggest barriers for consistent hand hygiene at their facility. Matthew Holmes said lack of accountability as well.
Yeah, and I think those responses are kind of similar with the previous question that was safety culture of the organization was also a thing. So it goes along together is that culture of safety, which also includes accountability, individual accountability, but also collective accountability.
Wonderful. Well, I think we can move towards your references.
Oh, there was another poll question. And those were my references. Dan, I'm going to turn it back over to you. And thank you all for joining us today. If you have any questions, feel free to reach out.
Yep. Thank you so much, Maimuna, and thank you everyone for joining us today for the 7th episode of our patient safety webinar. If you have any questions or would like the deck sent to you or the recording sent to you, please feel free to reach out to myself or Maimuna directly, and we can send that over. Once again, thank you for joining us, and we'll see you next time. Bye, everybody.